As winter approaches and COVID case numbers creep up, there is one message that Canadians need to hear over and over again. Limit your social contacts. It worked in the first wave, and it is essential now. Across Canada, with the exception of the Atlantic bubble, case numbers are rising fast. Even in Nunavut, which until a few weeks ago had no infections, there's now a spike. In the last 24 hours, 34 more people tested positive there, bringing the total case number in Nunavut to 60. Starting tomorrow, the territory enters 2 weeks of tough new restrictions. Here is the nationwide picture. Based on population, Manitoba still has the most active cases per capita, 512 for every 100,000 people. The second worst is Alberta, followed by Quebec and British Columbia. With the curve bending sharply upward, Canada's top doctor warns hospitals in some regions could soon be overwhelmed. In the last week, the national test positivity rate hit 6.6%. That means nearly 7% of everyone who got a test in Canada received a positive result. Some provinces are now considering whether to extend the school winter break to try to curb the spread. In some regions, even more drastic measures may be needed before that if people don't follow public health advice.
Our messaging has been quite clear: stay home, leaving only for essential reasons.
It is these small yet essential efforts, like staying home when we're ill, not having social gatherings.
We need everybody who can wear a mask to wear a mask in indoor public places. Stop making excuses because you don't feel like wearing a mask.
Abigail Bimman has more on the public health messaging and the criticism in some regions that not enough is being done.
We all need to double down to get this second wave under control.
A stark prime ministerial warning targeted at young people.
It could leave you with heart and lung issues, or it could cost you your life.
While the national messaging for everyone remains the same: masks, distance, limit contacts.
Every effort you make matters. As much as you can, limit errands and outings to just the essentials.
And I know it's hard to hear the same guidance over and over.
Canada's top doctors admit COVID-19 fatigue presents a challenge.
How do we get people to understand and appreciate that the situation now is just as severe, if not maybe even worse, compared to what we endured in the spring?
While critics call for more action.
Why is no one doing anything? I mean, what is it going to take? We have record cases. We have a death toll that's mounting.
The confusion out there is massive.
Those in harder hit zones are looking at stronger measures. Several provinces now considering a school winter break extension, though the messaging in Ontario isn't clear.
I'm seriously looking at solutions that may include some period out of class.
I just don't want to jump the gun here and say, be prepared. It may not happen.
There really is shared responsibility.
Dr. Isaac Bogosh sees the responsibility for COVID-19 control as threefold between government, individuals, and businesses.
We certainly have some things under our control. We should not be going into our neighbor's home for house parties. We should not be gathering in large groups.
Here in Ottawa, officials stress decisions are best made at the local and provincial levels because the situation is so different across the country. As an example, Dr. New said a national lockdown wouldn't make sense for Atlantic Canada or parts of the north. But he did offer one piece of news applicable to all Canadians. He said tentatively he's hopeful most Canadians could be vaccinated by the end of next year. Abigail Bimman, Global News, Ottawa.